I just finished a 6-month journalism program through Harvard called Media and Medicine. And the entire focus of my 6-month project has culminated in an article on birth trauma specifically and why women are experiencing such deep, profound disappointment in their birth experiences, finding out it's not what they had anticipated, that all their best loved plans are usurped or distracted, particularly in the hospital environment. And while you say for yourself, trauma may be a strong word, I want to just say 2 things about that. Obviously, I can't know the extent and depth of your experience, but a significant portion of women now in the UK and the US are actually able to be diagnosed as having PTSD, actual diagnosable trauma as the result of their births. And many women almost self-gaslight and say, okay, I have a healthy baby and I'm healthy, so maybe it wasn't trauma. Can we go in that direction a little bit? It's such a pressing issue here and in the UK and in so many places that women are struggling with now, and what we can do to help women through this conversation.
Yeah, it's a fascinating and really timely question. It's a big interest of mine, and actually just this year completed training in birth trauma resolution therapy, which is an intervention that midwives and other professionals can use to help people move past perinatal trauma. And you're absolutely right. Women and people who birth do tend to second guess themselves and say, my baby is healthy, or I was told to get over myself because my baby's healthy. And other women have it worse. And at least I'm not in a war zone, or at least I'm not a refugee, or there's always going to be somebody worse off. And we minimize our own pain. But absolutely, birth trauma is occurring on a mass industrialized scale at the moment. And a lot of that is to do with the mass industrialized nature of the maternity system, which has its differences between the US and the UK, but also some major similarities. And because the system has become such a kind of monolithic, industrialized machine, it's not able always to give the individualized, person-centered care that everybody deserves. We're very medicalized, we're very interventionist, very defensive practice in America, and also to a certain extent in the UK. Litigation is a big issue in obstetrics and midwifery. So people aren't always having that individual kind of holistic experience that they deserve. And this clearly has massive psychological consequences for a lifetime, really, especially if it's not properly addressed and given the time and space it needs.
Yeah, I'm creating an online program, which is an extension of something that I had created in COVID, the Mama Pathway. And we have a big segment on birth trauma prevention, but also birth trauma resolution. I think even just acknowledging it as we are here, someone might be listening going, oh, I have actually been telling myself that what I experienced wasn't as bad as it was, or it didn't happen.
Mhm.
So thank you for bringing up your own story.